Hello everybody, welcome back to my YouTube channel. It's your boy Dr. K once more, and on this beautiful day I have something very interesting I want to share with everybody. Today's topic has been one of controversy. It's been one that has a lot of views. People have different views about it. People have different experiences about it, and today's topic is family planning. Over the years of practice, especially back home in Nigeria, I've been opportune to see many patients who have had different experiences when it comes to family planning. Some have good experiences, some have not so good experiences, but then I usually say one thing, what is good for the goose is not always good for the gander when it comes to family planning. What is good for your sister might not be good for you, just like the way pregnancy is. What works for one person might not work for the other person. I've seen people who have extreme conditions that have warranted some very drastic decisions to be made in their health, while I've seen people just having it like a stroll in the park. Over the last 24 hours, I put up an opinion poll on my WhatsApp line, and I got different responses to how people feel about their experiences. Some had very horrendous experiences, some had very interesting experiences. As we go on, I'm going to try and bring those experiences in so that we can all learn and you can all also get one or two things out. One thing I want to implore you, if you have not subscribed, please click the subscribe button and also like the video, and also try and share as much as possible, because this information are key. This information really are very helpful. Thank you very much. I look forward to having more videos. I look forward to hearing your comments. I look forward to serving you better. Thank you very much. So today's topic, family planning. Two things I'm going to delve into with family planning. I'm going to talk about the types of family planning we have. I think we have about 5 or 6 different types. Then I'm going to talk about what the myth, people's regular belief that are not true about family planning. I'm going to talk about that too. So one of the common methods of family planning is called the natural method. As the name implies, natural. The woman and the man can try to target a fertility period. She checks her fertility period, and then in that period they stay away from intercourse, or that period they use condoms in that period. But then I must say that the downfall, or let me rephrase it, that the failure rate of natural method is about 24%. It means if you have a group of 10 people who practice natural method, almost 3 of them have experienced or will experience some failure because of the timing, hormonal changes. Some people ovulate earlier than they should ovulate, and then it becomes a bit muddled up. Thank God for the advent of flow chart or flow, whatever, that menstrual tracker chart on the phone. People are now able to get better successes. Before now it was really talked about. But also some people do withdrawal method. I have some friends who say, oh, my withdrawal game is bad. Withdrawal game is bad. Well, good, in quotes. Withdrawal game is good until withdrawal game is not good. It's still part of natural method, and that's what makes it the effectiveness very low. It's the least effective of all the family planning methods. Also, lactational amenorrhea. What does it mean? Lactation is when a woman is breastfeeding, or when she's expressing breast milk. So in the first 6 months, some women don't ovulate, thereby they don't menstruate because they are breastfeeding. But note, in this class of women, they now find it very easy to have unprotected intercourse at that point, and they won't get pregnant. But then one very important thing about lactational amenorrhea is, if you're not doing exclusive breastfeeding, lactational amenorrhea might not work for you. So that's the downside. So if you think, oh, I'm breastfeeding, maybe they said if you are breastfeeding, you will not. That's not true. I've seen a woman, let me just give you a case in point, where she was breastfeeding and she wasn't ovulating, and she thought she was safe. And then they continued enjoying themselves, and then at the end of the day, you found out that she was pregnant, and she came to the hospital after like a few months of her. I said, doctor, I've still not seen my period, but I'm having these lower abdominal cramps. The cramps are so much, but I've still not seen my period. I said, oh really? Okay, lie down, let's examine. And trust me, when the woman lay down, boom, the uterus was at the level of the umbilicus. She was 20 weeks pregnant. That's how dangerous it can be. So fertility awareness, withdrawal, and lactational amenorrhea are natural methods of family planning, but they are not the best methods to be used. I mean, so some people use it and they get away with it, but many people use it and they never get away with it. I mean, it's not a way we want to get caught in. The second method I want to talk about is the barrier method. So this barrier method has about 17% failure rate. Barrier method that people trust so much has 17% failure rate. Why does it? Barrier method, however, entails using male and female condoms and diaphragms and cervical caps. So why is the failure rate so high? The failure rate is very high because, one, there is a risk of not properly wearing the condoms. Some guys don't know how to wear it. Let's not even joke. They just think it's just to wear on top. There's a proper way to wear it. I'll do the video and I'll post it too. There's a proper way to wear it, and then when you wear it that way, no matter the intensity of the intercourse, it is less likely to break. And some people, it actually breaks because they don't wear it properly, and some people, it can pull out because they don't wear it properly. So barrier method, natural method, 24% failure. Barrier method has 17% failure rate. Also, the diaphragms is like the major type of female condom. Just wear it, and contains some spermicide. Those spermicide are what kills the sperm in quotes, and makes contraception come to play. Number three method. Although in my years of practice, I've seen so many cases of barrier methods failing. So many, Sometimes the couple are intoxicated, and when they have the intercourse, they don't even take into cognizance any form of safety, and they just wear what they need to wear, and then boom, they come cry, oh, the condom burst. Then we need to now go into another type of contraception, which I'll talk about later. 3, hormonal method. This hormonal method, just the way I said that Taye and Kehinde are different for pregnancy, this is what I'm talking about. Taye and Kehinde are different when it comes to hormonal methods of contraception. It can include birth control pills, it can include injections, it can include implants, it can include the patches, and also some form of vaginal rings. The birth control pills contain estrogen and progestin, and the birth control pill is like I should have brought an example, but I'll post an example. There's an arrow on it where you can follow, whereby you start from one end of the arrow and finish at the other end, where one end is telling you where to start using it from. By the time you get to I think it's about red or pink color, then there's a white color at the end of it, where at that point you are supposed to have a withdrawal bleed. Although there are new types that are just 21 instead of 28 tablets, they're just 21. They tell you after 21 days, this over, wait for another 7 days or another 5 days, or wait for when the bleeding stops before you start using another one. One of the downside of any hormonal contraceptive is that it can further boost up, make you very sensitive. It can further make the body very sensitive, and then cause some level of changes in the body. I usually say, I've seen a lot of people using injections, I've seen a lot of people using implants, and they've been doing very well on it. They've been doing very well, very fantastic. But the downside is that it can, okay, so let me talk about the failure rate is about 6%. So it means it doesn't really fail. It doesn't really fail. It's just 6 people in 100 people before you can see that it fails. So one important thing I must discuss about is the return to fertility, because as I said, the reason why you do family planning, and this is like the crux of the matter, the reason why you do family planning is because you want to save some time in raising the children that you have, and also maybe get your finances together, plan the family, family planning, plan the family before you now get into having another child. So there's this gap that is supposed to be between one child and another child. So between the time you start your family planning method and the time you are ready, if you are doing any hormonal method, we usually advise that you wait for 6 months. When it's 6 months to when you're ready is when you stop. So either you're using birth control, either you're using the injectables, or you're using the implants. The implants usually fixed underneath the skin, usually somewhere around here, either the left arm or the right arm. Some people prefer right, some people prefer left. I prefer the left, so because I can just feel it just fixed around here. So as I was saying, when it's 6 months to the time you are ready, they will now ask you to stop. But remember, some people, when they use these methods, they start to add weight. Weight gain is one of the shortcomings of hormonal contraceptive. Weight gain, some people start having hot flushes, some people start having irregular period. That's another thing. Irregular period, your period just shows up unannounced. While you are busy doing something else, the period just shows up because you are on implants or because you are taking the injectables, But then, when you now stop it, some people find it difficult to now conceive after they stop that method of family planning, even after waiting for 6 months. The major reason for that is weight gain. If you agree with me, many people that I've seen, even many people that came into my DM yesterday, commenting on my poll, actually lamented a lot about what they experienced using the injectables. That after using injectables, they added so much weight. Some people even had some increased blood sugar spikes. Some people had blood pressure spikes. So this is it. I tell my patients, before you get into any family planning method, make sure you speak to a doctor. Don't say because my friend is doing implant, that's the most fashionable one, I want to do implants. No, it might not work for you. See a doctor, have a conversation, because there are conversations to be had. Any family history of obesity, any family history of diabetes, any family history of hypertension, any family history of cancer, either breast cancer or any form of cancer. These hormonal injections can make it come forward, before time. So it's important to have this conversation and get it done with, before you start hormonal family planning. If you have any questions, please drop it in the comment section. I will answer you. If it means me texting you my phone number to have a proper conversation, I will do that. But if I don't respond to you, which I will, of course, you can also reach me on my Instagram, drkuli on my Instagram. I will respond to you definitely. The other method, we are coming down in level of effectiveness. I said this one is about 6%. The hormonal method is about 6%. But there is also what we call the intrauterine device, the IUDs. The IUDs have about 2% failure rate. Just about 2% failure rate. In fact, I encourage a lot of first timers to do the IUD. Just me from my experience so far. The reason why I encourage them is because the IUD is easy to fix. And if it's properly fixed, it will stop any form of conception. And then when you're ready, it is easy to remove, because what makes family planning method enjoyable is the ease of reversibility. Now I'm ready to have a child, or now I'm ready to have another child. You go there, remove it easily. It has its own shortcomings too. For example, there was one particular woman, she also came to my DM, who said she had an IUD done, and then because she went for a cervical screening, the person that examined the cervix just inadvertently shifted the IUD. And then the IUD can be of two types. There's a hormonal type that releases progesterone to around that area, so it prevents pregnancy. There's another type that's called copper T. That copper part of copper T is like a spermicide. It kills the sperm as it's coming there. So for our own, the IUD now shifted, and then boom, she got pregnant. she got pregnant, she had a child, and then she went into full ballistic mode. She had to do like a tubal ligation, which we'll get to later, before she could be satisfied with the method she has chosen. And I'm sure you've heard of children coming out with copper tea in their hands. I have seen one that came out with copper tea on his head. Yes, because during some form of rigorous encounters or rigorous intercourse, there is a possibility that we can shift the IUD if it's not properly done. Yeah, and then that's basic. As the case may be, that's a blessing. Let me not say basic. That's a new level of blessing that can come to that family. That's copper tea. And also copper tea. One of the contraindications of copper tea, we usually ask if a woman has a history of fibroids. Women who have fibroids are not encouraged to use copper tea. Why? Because fibroids will automatically at some point cause increased bleeding on your menstrual flow. And also copper tea has been shown that in the first 3 months of copper tea, there could be an increase in flow of your blood. Just the body recognizing it as a foreign object and wanting to push it out can make you bleed more, of which after 3 months, the body gets used to it and then everything comes back to normal. That's the shortcoming with copper tea. If you have any other experience, please drop it in the comment section. I'm very, very interested to hear all your comments. Also, one other method that has just 0.5% failure, in fact, it almost never fails, is a permanent method. Hey, what I'm going to say here, some people will not talk to me again, but then I'm sorry, I will say it. Tubal ligation. Tubal ligation is when the tubes are clipped and cut. They clip it, then they cut it. This is a surgical procedure. Most women like to do their tubal ligation when they are having their children or having their child, last child, of course, maybe doing like an elective CS, and they just clip the tubes and cut it. That's tubal ligation. The only problem that can occur is when the doctor didn't cut it properly, didn't tie it properly, and then there is recalibration, recannulation, and then the whole, it's 0.5 failure. Means before you see 1,000 people, if you pick 1,000 people, maybe like between 1 or 5, between 1,000 people, so it's really very low, But then, one of the side effects of tubal ligation is that person has been predisposed to early menopause. So it might not be the best option. That's why I said, before you embark on any family planning method, make sure you speak with your doctor. So the next method, vasectomy. Well, in as much as many people have their reservations about vasectomy is a surgical procedure that cuts without reversal the tube that brings the sperm from the scrotum to the shaft. It's called the vas deferens. They cut it off. Many people have their thoughts on it. I have my thought on it, and I'm going to say what I think. Even though somebody told me not to say what I think, I said, I'm going to say what I think. Personally, vasectomy is not a method I will employ for personal reasons. And I said, vasectomy is I've not seen anybody do it. I've seen somebody said she has seen 2 people. I haven't seen my whole years of practice people who have. Okay, I saw one person who voluntarily came for vasectomy, and I referred him to the urologist. I don't know how that matter ended, but have I seen one who did it? No, I haven't. But I've seen a lot of women talk about it. But I say, the decision to do any family planning method should be one that has been discussed and concluded by the husband and the wife or the couple in question. It is when you decide this is what we want, then you go to the doctor gives you all your options, screens you out of some options, then you guys will decide this is what we want. That's my own take on vasectomy. most African men will not take vasectomy. Most African men will not take vasectomy, and you know, it's just because there's this poor education about it that shows that there might be some level of demasculinization, and I mean, it's not their fault. This some women, you know, have actually done some terrible things to their husband who had vasectomy because they just want to have a small family, you know. Then along the line, some things came up. One was a rubbish story that I heard, you know, which I think would have made more men not want to be demasculinated, in quotes, not exactly, but in quotes, you know. Also, the sixth form, let me try and be fast. The sixth form of contraception is the emergency contraception. The most common one is the morning after pill. You know, morning after pill is should be taken within 72 hours of when the intercourse took place, not after 72 hours. Because I've seen people who have done terrible mistakes, who have made terrible mistakes, you know, and there's a dosage to it. You know, you are not supposed to take the two at once. That popular one you people know. You are not supposed to take the two at once. You're supposed to take one, then take the second after 12 hours. There's a 12-hour window between these two tablets. I've corrected people a lot, but you know, people have their own, you know. I even had the like call it a fight. I fought somebody something. I told you to use this in this way. Now you're using it this way. Now you're coming back after about 3-4 days. Now telling me that. You know, yeah. There's some myths I would like to clear. Some myths. Yeah, I'd like to clear about family planning. What people think is correct, but are really actually not correct about family planning. First thing, that contraceptive pills can cause infertility. No, contraceptive pills cannot cause infertility. You know, you will return to fertility once you stop the pill. As I said, they give you that time, 6 months before. When you're ready, you're going to be ready in 6 months' time. Stop the pill from now, so that every form of the pill or the injection can be metabolized away from the body, and the body gets back to normal shape. And if you have added weight in that period, make sure you try to shed some weight and get back in shape before by the time you start by the time you're ready to conceive. Then also, there's this one as I mentioned earlier. They said you can't get pregnant while breastfeeding. It's a lie. You can get pregnant. That is why natural method has 24% failure rate. You can get pregnant. And then if you think if you think you want to try the natural method, that's the lactational amenorrhea method, because you are breastfeeding, you're not seeing your period, you want to try that method, you have to make sure you are doing exclusive breastfeeding. You have to make sure you are doing exclusive breastfeeding. Another thing is, say withdrawal is a reliable method of conception. It is not reliable. I said it, 24% failure rate. Don't try it. Withdrawal is not a reliable method. You know, they said condoms are ineffective and always break. No, condoms are very effective. As I said, 17%. The failure rate is 17%, and it's only 17% if it is worn properly. They usually break because it's not worn properly. If you wear it properly, it will not break. Some condoms are made for to last for a long period of time, you know, if properly worn. Another one is, they said modern IUDs are unsafe and can cause infections. No, that was in the olden days. But what we do now, you know, the methods that they used to insert IUDs now are better methods. You know, the way you check, there are better ways to handle them right now that they will not cause any form of infection for you or your partner. Another one, you say you can't get pregnant on your period. However, there's a school of thought that disagrees totally that during your period, you cannot get pregnant. But then we've known that it is in about 0.5 to 1% of women can get pregnant even during their period. So it's not like one size fits all. All these theories are not one size fits all. There are some variations, there are some variables, there are some special people that defy the normal order of things. Also, they say only women are responsible for contraception. What I usually say is contraception, when it comes to family planning, the husband and the wife must discuss with the doctor. You must both carry yourself to the doctor, discuss with the doctor, then choose a method. Don't just say your wife should go and do family planning. No. I've seen so many people say, so when the intercourse happens, they say, my husband was angry. My husband was even angry. Why was your husband angry? He say, was angry that I got pregnant. Why was your husband angry that you got pregnant? Were you the one that impregnated yourself? No. Your husband should not be angry that you got pregnant. He should be angry at himself that he did not encourage you, or both of you did not encourage yourself to go for family planning. So as it's important for the man, for the woman to be involved in family planning, so is it important for the man too to be involved in family planning. It's a two-way thing, Family planning is important for managing reproductive health, and understanding the method and debunking these myths will help individual make informed choices. Yeah, man, because now, you've watched this video, now you know. It's important for you to like this video, share this video, drop your comment, let me know what you think. Subscribe too, don't forget to subscribe, and I'll see you again in the next video. Thank you very much. Bye bye.